to start with, this is really where I sit personally on non-steroidals in the perioperative period. Any animal in pain should be given a non-steroidal unless you can find a very good reason not to. And that's where I start. Any patient, when I'm planning an anaesthetic, my opinion is this patient needs a non-steroidal to control its pain, and we'll look at some of those reasons why tonight. And if anyone's after any extra reading, some of that is explored, and some of the other options that we'll talk about tonight are explored in this review just below here that I wrote a couple of years ago in the Journal of Small Animal Practice. So that's probably quite a good set of notes for tonight's talk, really. So looking a little bit at UK standards in provision of analgesia, there was a survey conducted from the University of Bristol survey was actually conducted in 2013, reported earlier this year in the Vet Records, so I'm sure some of you may have seen this. Now, the last time work like this was done was 1999 from a similar group at the University of Bristol, and things have changed quite a bit since then. In 1999, only 50% of vets surveyed were prescribing analgesia for routine surgery, and by routine surgery we're talking about spays, castrates, lump removals, dental procedures. By 2013, all of the 720 respondents in the survey said they have an opioid and a non-steroidal available in their practice. Of those respondents, 98% of people give opioids and non-steroidals for surgery. 90% are giving dogs opioids, but only 81% of people are giving cats opioids. 75% of people are confident giving dogs non-steroidals, but only 33% are confident, and this is 2013, in giving cats non-steroidals in the perioperative period. So there's clearly a little bit of information required here, maybe some fears that need allaying, but as I've already said, my opinion is 100% of those cases should certainly be considered for administration of a non-steroidal during the perioperative period. You know, notice I'm saying perioperative period, that could be before surgery, it could be during surgery, it could be after surgery. So we're not necessarily giving our analgesics at a predetermined point. When we look at some of these results from this same study, they looked at which opioids people have in practice and which non-steroidals people have in practice. And I'm quite confident this is representative of all of us here tonight. If we look at the second line with non-steroidals available, the vast majority of people in practice have meloxicam and carprofen sat on the shelf. A high proportion of us have firocoxib, Previcox available on the shelf. Obviously there's only an oral preparation for firocoxib, so there's no injectable available. Rubinacoxib, Onsior, injectable and oral preparation for dogs and cats. Simicoxib, Simalgex, again that's an oral preparation. And a few of us still have ketoprofen and tolfenamic acid sat on the shelf here. Notice that I just picked up on the fact that mavacoxib, Tricoxil is not on that list, and I'm not entirely sure why. But we'll talk about some of these non-steroidals tonight. These 3 points are aimed with analgesics are actually taken from a paper that I read on opioid analgesics, but personally I think these apply to non-steroidals as well. We're trying to provide pain relief. We're trying to provide pain relief without the side effects or reducing side effects wherever possible, and we're trying to improve function in that patient. So if it's the lame dog, then we're trying to improve limb function. If it's the cat with dental pain, we're trying to improve the cat's ability to eat. So we just need to bear this in mind. I'm very convinced that we definitely do need to use non-steroidals, and I hope you are too. If you're not, then I hope you will be by the end of this webinar. This was a study reported in 2013, conducted before that, looking at a comparison of dogs undergoing orthopedic surgery that received either buprenorphine or methadone, and in both groups they received meloxicam. I know we're talking about non-steroidals tonight, so please bear with me. I'm not. There is a point to this slide talking about opioids. They looked at pain scores in these patients. Now, bear in mind, the methadone and the buprenorphine were given before surgery, as was the meloxicam. The pain scores that they used were the short form of the Glasgow Composite Pain Scale, which I'm sure some of you are familiar with. It's a well-validated pain score in dogs. The second pain score they looked at was a dynamic interactive visual analog scale, and that dynamic interactive means that the investigators interacted with the patients, they palpated the wounds, and then they assigned a pain scale based on zero, no pain as being 0 and the worst pain imaginable being 100, and they would put a cross on that line between 0 and 100. Now, using those pain scales and looking at the difference between the methadone and the buprenorphine group, they were able to document that the methadone group were a lot less painful than the buprenorphine group in both cases. Now, I know we often think, well, methadone being a full mu agonist is a better analgesic than buprenorphine, but actually this is the first study in dogs that was able to positively document that effect. The other thing that these investigators looked at to support their finding was the additional analgesia requirement in those patients. And of the dogs in the buprenorphine group, 79% of those dogs required further analgesia before they would due their next dose of buprenorphine. And that dropped down to 42% in the methadone. So again, decent evidence that this opioid is superior, methadone is superior to buprenorphine. But why are we talking about opioids and not non-steroidals? Notice that in both of these groups, these patients also receive meloxicam, yet with the superior opioid methadone and meloxicam, still 42% of those patients required additional analgesia. So actually, whilst I would argue, yes, we need to use non-steroidals, I would also argue that we need to use more than non-steroidals. I know we're all very familiar with the concept of multimodal analgesia. My third choice in any painful procedure has got to be a local anaesthetic technique. It's something I try to incorporate into every single anaesthetic I do for where there's going to be some sort of painful experience. So if we think of analgesia provision as a triad of analgesia, non-steroidals, opioids, local anaesthetic, let's try and incorporate all of these components into every single anaesthetic where we're going to be operating on that patient. Of course, we need to use non-steroidals in cats too. We probably need to focus a little bit more on cats and making sure cats get non-steroidals and that people are confident in giving non-steroidals to cats. This was a study from '98, so you could say it's an old study, it's an incredibly valid study. And it was looking at a variety of analgesics, so ketoprofen, a non-steroidal, buprenorphine, pethidine, both opioids, or no analgesia at all. So that was a control group. And these were clinical cases undergoing ovariohysterectomy. And you'll note from the paper that these analgesics were given after the surgery, so they were given when they say in the paper when the anaesthetic gas was switched off at the end of the procedure, and the cats were otherwise anaesthetized with agents that had no analgesic properties. So these were the sole analgesics studied in these individual cats. So they either got ketoprofen or buprenorphine or pethidine or nothing. The outcome measures that these investigators used after the SPACE study was the requirement for further analgesia, so interventional requirement. They considered their overall assessment of the cat. They did a dynamic interactive visual analog scale. And these 3 assessments were conducted at these various time points post-surgery. And if we look on the next slide, we've got the outcome of those studies. So we've got top left is the assessment 2 hours post-operatively, then we've got 4 hours post-operatively compared with 8 hours post-operatively